And this is Dr. John Phillips with this week's case. I think that part of what we do is learning from, I wouldn't say our mistakes, but just kind of misadventures sometimes. And a few weeks ago, I was taking care of a gentleman who had limb-threatening ischemia, meaning he was on deck for a major amputation. He'd been turned down several other places, and he had blocked artery behind the knee. And oftentimes we have to put a tube in kind of facing down towards directly in the affected limb. And, with that tube, we can advance wires and little tiny catheters to try to open up that vessel. Oftentimes that doesn't work. And then we have to put a tube in the foot and kind of connect the dots from above and below, which we were able to do. But in doing so, there was so much calcium. Sometimes the arteries can become very stiff and full of calcium that makes it difficult to get back into what we call the lumen, or the natural opening of the vessel. And we put a little hole in it, and we fixed the vessel up, and we have special stents that have a coating on it, and we were able to cover it. And we thought we had fixed the leak. And unfortunately, the gentleman developed what we call compartment syndrome. The leg has four compartments, and the leg is a fixed structure. And so if you're bleeding into those compartments, the leg can get very tense and stiff, and you can actually threaten the limb becomes threatened. And so he had to go for what's called a fasciotomy, or surgery. We were able to save his leg, and he was able to, he did okay after the fasciotomy. But it's a cautionary tale of, number one, we play with dangerous tools sometimes, but those tools allow us to open up blood vessels, and there are complications. So it's always important to, as a physician, to make sure that your patients are aware of the complications. And the first rule of what we do is first do no harm. And so we're balancing the good and the bad. And thankfully we're successful, but we had a little complication that we were able to treat.